Today we're going to talk about the new law that was passed, the Families First Coronavirus Response Act. This was a new piece of legislation that was passed by Congress on March 18th and signed by President Trump. We're going to go over the basic provisions of this law. The final regulations, there were a set of final regs put out on Monday, but there's still some regulations being written on this. So I am by no means an expert, but we will give you the basics. Some of the nitty-gritty details you may want to talk to your attorney or your accountant, or maybe you have an HR person. When it gets into the fine details, I would recommend and highly recommend that you contact some experts on it. We will definitely try to answer any questions you may have, okay? So the basic provisions of this new law. It's a restricted time frame when it is in effect. It started April 1st, which was last Wednesday, and it expires on December 31st. So it's a very specific time frame that it's in place. It does require that employers who employ less than 500 employees, so from 1 to 499 employees, you have to provide expanded paid leave for individuals that are impacted by COVID-19. This does include state and local government employees, so municipalities, villages, water districts, public water supply districts. This all applies to you. It does not apply to some federal employees. They have their own thing, so that's one of the exceptions. But for most of you, cities, water districts, this will apply to you if you have one employee. Now, if you have employees who have been off because of COVID-19 illness before April 1st, this does not look backwards. It is not retroactive. So this is effective for leave taken from April 1st on, okay, till December 31st. So it doesn't look back. There's basically two types of benefits under this law. One is called the Emergency Paid Sick Leave, and the other is the Emergency Family and Medical Leave Expansion Act, the EFMLEA. So for the rest of the presentation, I'm going to use these acronyms, so kind of keep those in your head as to what I'm talking about, okay? So we're going to talk about the emergency paid sick leave part of the law first, okay? So what employees qualify? An employee qualifies from the first day of employment. So unlike the regular FMLA, you know, under the regular FMLA that we've had for a long time, the employee had to have been employed for, I think it was 12 months and like 1,250 hours. That is not the case here. An employee is eligible for this from the first day of employment, okay? No prior service is required to be eligible, for the employee to be eligible. An employee qualifies for the emergency paid sick leave if they are unable to do their work or telework from home for the following reasons. And there's 6 reasons given under the law as to what would qualify for this paid leave, okay? So we're gonna go over those. The first one is the employee is subject to a federal, state, or local quarantine or isolation order. And from the guidance documents I've been seeing, a stay-at-home or a shelter-in-place order like we have in Missouri does not qualify for this. If you read the language carefully, what Governor Parsons put out was they recommend that you don't, you know, that you stay home and you only go for essential services and et cetera. But so this is a local quarantine or isolation order from a governmental entity, and just a stay-at-home or shelter-in-place would probably not qualify here, okay? The second reason is an employee has been advised by a healthcare provider to self-quarantine due to COVID-19. If they have something from a doctor or a healthcare provider that says you should quarantine for however many days, then that would qualify for that employee for this paid leave. Okay. The third reason, if the employees experience COVID-19 symptoms and is seeking a medical diagnosis, so they're running a temperature, they're coughing, they're short of breath, and they are waiting to get the test or whatever, then this would qualify them. Now, this has got some, gray area in it, in my opinion. Again, you kind of got to look at each case on here. Number 4, caring for an individual subject to an order described in 1 or 2. Now, 1 was, if you remember, 1 was where the local government or state government has issued a quarantine isolation order, and 2 is where they are self-quarantining on the advice of a healthcare provider. So if your employee is caring for someone who has done that, then they would qualify for this. Now, who would be an individual that they would care for? The guidance document says the employee has to have a relationship with the individual that's being cared for. So it would have to be somebody like a spouse or a close family member, a child, or a roommate is one of the examples given. But there has to be a reasonable expectation that the employee is in a position where it's expected that they would care for this individual. So it can't be an employee who has been hired to take care of somebody, okay? They have to have a relationship with the individual. Number 5 is caring for a child whose school or place of care is closed. So the schools have all closed. So if you've got a child, and the definition of a child is someone under 18 years of age, or 18 or over if they've got a disability that would require care. And the reason that the school is closed or the child care is not available is COVID-19 related. So that is the one for that one. And that gets real complicated with the next one we're going to talk about. Number 6 is kind of the catch-all. If you have an employee experiencing any other substantially similar condition specified by the Secretary of Health and Human Services in consultation with the Secretary of Labor and Treasury that is COVID-19 related, then they would possibly qualify. So I call that the catch-all thing. I haven't seen anything specified by the Secretary of HHS yet, but there may be, okay? So those are the 6 reasons someone would qualify, an employee would qualify for emergency paid sick leave. So if they qualify, what are they eligible for? So a full-time employee would be eligible for pay up to 80 hours of paid leave over a 2-week period. So what does that mean? If you were a normal employee, you work 40 hours a week, that means you would have 80 hours in 2 weeks' time, and you would be eligible for pay. But let's say you only work 36 hours a week, considered full-time. Over the 2 weeks, you would have 72 hours of pay, and that's all you could get because the maximum is 2 weeks, and you only worked 72 hours in that 2 weeks. So it's up to 80 hours, but 2 weeks is the defining period. So you would be able to get 2 weeks of pay. Now, if you're a part-time employee, you are also eligible, and you would be eligible for the average number of hours that you would have worked over a 2-week period. And the way they're doing that is you would look back at that employee's average hours, weekly hours over the previous 6 months' time, and average that out, and that's what they would be eligible for the 2 weeks of paid sick leave. If they haven't been there 6 months, you can, if they've already been scheduled, it would be for the time that they're scheduled, or averaging what they have for the period they have been working. That's one that if you have someone in that position, you probably want to maybe get some advice on how to calculate the hours for that part-time. But if they've worked there for over 6 months, you would look over the past 6 months, the previous 6 months, and figure out what their average hourly, average hours per week they worked. And that's what their pay would be based on, okay? Again, it's 2 weeks maximum that they would be covered under this leave, okay? So that's how many hours they can get paid. Okay, so somebody want to know what was reason number 6? Reason number 6 out of the 6 reasons they would be eligible was the catch-all. If there was anything else COVID related that basically the federal government says would be eligible. So it's kind of a catch-all, it's not real specific, okay? Okay, so how much can they get paid? Okay, so for emergency paid sick leave, for reasons 1, 2, or 3. So 1 was if the state or local government has issued a quarantine or isolation order, which probably has not happened in Missouri. Number 2 was if you have been recommended to be in isolation due to a healthcare professional's recommendation. And number 3 was you have symptoms and are waiting on a medical diagnosis for COVID-19. If your employee requests leave for one of those reasons, 1, 2, or 3, okay, employees would be paid their regular rate of pay or the applicable minimum wage, whichever's higher, up to $511 a day or $5,110 over the 2-week period. That would be the max they could draw. So it's whatever their pay is up to those limits, okay? And I didn't say, I forgot to mention at the beginning, this PowerPoint, we're gonna put this on our website in our download section. So after this is over, so later today, you'll be able to download this PowerPoint and look at all of these again, just so you know, okay? So for reasons 1, 2, or 3, basically if somebody is sick or ordered to isolate, they can get up to $511 per day or $5,110 over the 2-week period. Now, if your if your employee asks for leave for reasons 4 or 6, so 4 was caring for an individual who has been ordered to quarantine on the advice of a health professional, or the first reason there's been a government order to quarantine or isolate. If your employee is a caretaker in that situation, they can get 2/3 of their regular rate of pay or 2/3 of the applicable minimum wage, whichever is higher, up to $200 a day or $2,000 over the 2-week period, okay? So it's quite a bit less. For reason 5 was the employee requests leave because they have a child who is no longer in school or does not have child care available to them for COVID-19 reasons. The employee shall be paid 2/3 of their regular rate of pay or 2/3 of the minimum wage, whichever is higher, up to $200 a day or $2,000 over the 2-week period, okay? So that is the dollar amount that they can be paid. So, and I split number 5 out because number 5 is under the next part of the law and applies to both. So even though it's the same rate of pay, that's why I split that one out. I didn't want you to be confused, but we're all pretty confused at this point, okay? Okay, so okay, so there's a question about employee brings a doctor note because they're at high risk. We're going to talk about how an employee accesses leave in a minute. They draw 2/3 of the pay for 2 weeks of an average hours they work. So the employer pays the employee, but how do they get reimbursed? We're going to talk about that in a minute. So just hang with us. Okay. And we will get there. Okay. Now, if an employee wants to take emergency paid sick leave, they must give notice to the employer that they want to take leave and why they want to take it. They have to list one of those 6 reasons, right? You need to have that documented in writing, probably for record keeping purposes. And you need to have, and you can drop your own form. There's no form that the government has put out, but the employee must give reasonable notice. Now that reasonable notice is probably going to be very short, okay? They're going to come in and say, my doctor has said I need to quarantine for 14 days because of COVID-19. I've been exposed or whatever it is. They're probably going to want to start that immediately. But you need to probably have that documented. You need to document the date that they notified you. You need to document the dates of leave that they're requesting. How long of the leave are they requesting? You need to document the reason for the leave. Did it meet one of the 6 criteria that we just went over? And if they have, you need documentation. So you need the isolation order from the local government or state government. You need the name of the health professional who gave them the quarantine orders, that type of thing. You need documentation that there's a pending test, something in the record to prove that they gave notice and requested leave, and here's what they are asking for, okay? So the paid leave begins immediately. There's no waiting period. If they came in and noticed today that I want to start taking leave tomorrow, leave starts tomorrow, okay? If they meet the criteria. You cannot require your employee to take available paid time off prior to qualifying for EPSL. EPSL circumvents company paid time. They get the EPSL before they have to take vacation leave, sick leave, paid time off, whatever. They qualify for EPSL from day 1, okay? So you have to pay that. Now, where it gets real tricky is, and I've had this question before with phone calls prior to today, can they take it in intermittently? So can I take 2 days today and 2 days next week? Yes and no. The guidance says that you have to take it in 1-day increments if you are taking the sick leave. Remember, this is sick leave. If you're taking the sick leave because you've been ordered to isolate from a healthcare professional, or the reasons 1, 2, and 3, basically, and maybe even 4, if you've been ordered to isolate by a healthcare professional, by the local government, or you've got symptoms, you cannot take intermittent. You've got to take it 1 day in 1-day increments until your symptoms are gone, or until your doctor says you can come back, okay? So no intermittent leave in that situation. Now, if you're caring for a child under the child care provisions, which was reason number 5, or you're a teleworker, you're working from home, you can take it intermittently. The thing is, your employer and you both have to agree that that's how you're going to do it. If the employer says no, then no, you have to take it in 1-day increments, okay? But maybe, I don't know, maybe you've got a child care situation where the babysitter will take so many kids 1 day and so many kids the next day. I don't know what that situation would be. But if you have intermittent child care, then yes, you can, but the employer has to agree, okay? So you have to take the EPSL first. You cannot require them to take their company paid time off first, okay? And that is different from the regular Family Medical Leave Act, okay? Again, I'm going to go back to the documentation I talked about at the first of the screen, or first of this slide. Document all of this. You have to keep that documentation for 4 years, by the way, in your records. So again, you want to document the date the employee gave notice, the date of the leave, you know, when did it start? When did it end? The reasons they qualified for the leave. And that documentation needs to include either the order of isolation or the doctor's name, if the doctor or the healthcare provider ordered them to be isolated, or documentation of a pending test, et cetera, like that. And then you need to document how much pay, what their pay was, what their wages were during this leave, okay? And again, you need to keep all of those records for at least 4 years, okay? Okay, so that was the emergency paid sick leave, okay? Now, the Emergency Family Medical Leave Act, this is the child care, basically, portion of this, okay? This is not sick leave. This is for family medical leave, okay? So for an employee to qualify for this, they must have been employed for at least 30 days prior to taking leave, okay? So if you hired someone last week and they ask for this Emergency Medical Family Leave Expansion Act leave, they wouldn't qualify. They have to have been your employee for at least 30 days, okay? To qualify, the employee has to be caring for an individual who's subject to an order of quarantine or isolation or subject to self-quarantine upon advice of a health professional. So again, that was number 1 and number 2 from the paid sick leave reasons, okay? So same thing here. The employee has to be caring for an individual. Again, they have to have a relationship with that individual. They have to be, it has to be a spouse, a family member, a child, a roommate that needs care. So that is similar to what we saw under the paid sick leave. And the third reason is you've got a child whose school or child care is closed or unavailable because of COVID-19. Again, a child is considered a person under 18 years of age or is disabled. Okay. This is not a leave that's requested by the employee because the employee is sick. That would be under the paid sick leave, okay, that we just talked about. This is for family medical leave, basically if they're caring for someone that's impacted by COVID-19, okay? So that's kind of the difference. Now, this gets a little involved. So paid leave under this portion of the law begins after the first 10 days that the employee is on leave, okay? So they ask to be on leave for emergency family medical leave because they have a child who's out of school and there's no child care available for them and they have to stay home and take care of the child. The first 10 days are unpaid under this, okay? Provision. However, if you recall, under the emergency paid sick leave, taking care of a child who's out of school or care of a person who's been impacted was eligible for emergency paid sick leave under this. So they can get paid for the first 10 days if they ask for leave under EPSL, and then they can ask for leave under the EMFLEA and get the first 10 days paid that way. But they've used up their emergency paid sick leave, okay? And they only get to do that once. So once they use it up, they've used it up, okay? So theoretically, if someone has a child who's out of school and wants to use their paid sick leave on the first 2 weeks and then this on the remaining 10 weeks, they can do that and get paid for the entire time, okay? That's a little confusing. Under this, the employee is entitled to 10 weeks of paid leave after the first 2 weeks or after the first 10 days. So total, there's 12 weeks of leave here. Only 10 of it is paid, okay? So they get paid 2/3 of their regular rate of pay or 2/3 of the minimum wage, whichever's higher, up to $200 a day or $10,000 total over the 10-week period. Now, if they applied and got the EPSL in addition to this and kind of ran them concurrently, then they can get a total of $12,000 over the 12-week period if it's combined with the emergency paid sick leave, okay? And this can be taken intermittently, you know, every Monday and Wednesday for the next 12-week period, as long as the employer and the employee agree. Okay. Now, again, it's a 12-week period, and $200 a day up to $12,000 total. But if they only take 2 days a week for the next 12 weeks, they're not going to get the whole 12,000. Okay. So it's not either 12,000 or 12 weeks. It's 12 weeks total. And they can get up to $12,000 over that 12-week. Okay. Again, the employer cannot require the employee to take company leave, paid leave for the first 2 weeks. So you can't say, well, we're going to give this to you, but you're going to have to take your vacation days for the first 10 days, and then you can get this paid sick leave. You can't do that. They can either combine it with the emergency paid sick leave, or they can take unpaid leave for the first 10 days. But you can't require them to take their vacation time or sick time for the first 10 days of this. Okay. So that's different from the regular FMLA. Okay. So one thing somebody kind of alluded to, right? If someone takes their 2 weeks of EPSL, they only get 2 weeks of EPSL. So if they're caring for somebody and they decide to take their paid sick leave and they've used that up, and then they become sick later, they can't take EPSL the way I read it because they've already used it for the time period. So they don't get to, and they don't get to use it for each child, right? It's just, it's a 2 week period. Same thing with childcare. It's a 12-week period between now and December 31st. And once you've used it up, you've used it up. Okay. Now, if they have company paid sick leave, company paid sick leave or vacation or whatever your benefits are, that's a different story. They can take that, but they don't get to do leave under this act multiple times. Okay. So some other items of note, there is some exceptions. Employers with less than 50 employees, which would probably be most of you. There are some exemptions if you can prove that complying would force you to close your business. Most of you won't qualify for this because you're probably not going to close. The city is not going to go out of business, or the water district is not going to go out of business if you comply with this. So it's not likely. This is not likely to be an exception available to governmental entities like cities or water districts. Okay. The law does specifically exclude healthcare providers and emergency responders who are employed by employers under this law. So water districts probably wouldn't, this wouldn't apply to you, but a city that has, if they, I don't know, have EMTs that are city employees, or a city or county hospital and they're employees of the county, then these workers are excluded from this. I think there's something else that deals with them, but it doesn't apply to healthcare providers and emergency responders who are employed by these employers. Okay. The other thing is, like we said earlier, this has an end date. The paid leave under this does not carry over from year to year. As of December 31st of 2020, it's done. So if you're in the middle of your leave on December 31st, it's done. You don't get to carry it over. And employees are not entitled to reimbursement for unpaid leave upon termination, resignation, retirement, or other separation from employment. So it ends on December 31st. Unless Congress does something more, this leave will no longer be available after that date. Okay. Now, some of you've asked, how do we get reimbursed for the money that's paid out? Well, unfortunately, there are tax credits available for employers, and if you were a private business or a private nonprofit, you would through tax credits, you would be able to recoup your costs. However, I don't think because you're a governmental agency that you're going to qualify for these tax credits. Some stuff I'm reading from the Treasury Department excludes governmental agencies from being eligible for the tax credits. So it sounds like to me that you will not be able to recoup the costs for this leave through tax credits. I'll continue to do some research on that, but it doesn't sound like it. So if you own a private business and you're having to do this, then yes, you can get the wages and the taxes and the health insurance premiums that you paid for this employee while they're on leave reimbursed to you through tax credits, but it doesn't look like it's going to apply. So a question is, can you terminate an employee while they're on leave? Basically, no, you cannot. And furthermore, when they come back, you have to bring them back in the capacity where they left. You have to hold their job for them, okay? So I'm going to say just generally no, you can't terminate them while they're on leave, okay? Now, don't confuse this. These two items in the law are to deal with employees who get sick or who have to care for someone who gets sick. This does not qualify an employee for benefits if the employer has laid them off because there's no work or has laid them off because they've temporarily closed their business. That is not sick leave. That is unemployment. And so if that has been the case where you've laid them off because you don't have anything for them to do, then they need to file for unemployment benefits and not this, okay? There is a new poster that you have to post where you post all of your other workplace posters. You know, you have to post the minimum wage and all that kind of stuff. There's a new poster that has to be posted, and it should have been posted last Wednesday. And if you don't have it up, you need to put it up like now, okay? There's the website for it. You can go to, you can probably just Google new COVID-19 workplace poster, and it'll pop up, but you need to, and you just have to pull it up, print it off, and post it. You don't have to buy this. You don't have to spend any money on it, okay? You can just download it and print it off on your printer, and then put it up where you put your rest of your workplace posters. Here's a picture of what it looks like, okay? So if you don't have that, you need to get it and make sure you get it posted, okay? So that was a quick run through. Those are the primary provisions. Everyone, if you're a public entity, if you're a political subdivision, this applies to you. And you need to make sure you understand the basics. If you have employees and there's some areas that you're not sure, then you know, I would encourage you to talk to your attorney, talk to your accountant, talk to an HR person. You can call us. We can try to find the answer for you. But this does apply to you. So, and I just got word that this poster will also be on our website. So you can download it off of the MRWA website, which is moruralwater.org, and get it there, okay? So that was a lot of information in a little bit of time. And if you have any other questions, type them in. If not, thank you for joining us. I hope it was useful, and I hope this was a good method of providing this information to you. We would really invite any feedback. If you can email me or text me to see what you think of this format. We'd be very interested to know what you thought. And if you didn't have any questions, you're free to leave the meeting, but I will stick around and listen and try to answer any questions that get put in on the chat box. So, okay. Anybody got any questions? I'm not seeing any. Okay, so I'm going to stop sharing. Okay, so it says, are there monies available to entities that are not governmental? Yes, there is. If you're not a governmental, if you're a private business or a private nonprofit, there's tax credits for this. And you need to talk with your accountant or whoever does your payroll taxes to get those done. And those are immediate. So, and you can get 100% of the expenses you had with this reimbursed to you as long as you're not a governmental agency. But talk to your accountant, talk to whoever does your payroll, and they can help you with that. Okay. Again, somebody asked about a recording. We did record this. And so that recording, the links to that recording, we're going to put out probably later today or tomorrow. Probably later. It'll be available in a day or two, and you can go and download the link and get the recording. Okay, so it will be available, and we'll let you know when that happens. Okay. Okay. Somebody said maybe we can do a webinar on how to set a Zoom up for a board meeting. We could do that. It's really simple. I think all of you that checked in today, that's how easy it is for you to participate in a Zoom. I guess the difficulty, it's not really difficult, is as the host, making sure you have it set up the way you want it to run. And there's a little bit of a learning curve on that, but it's not much. And so I'd be glad to help you do that, and we may do that. So, okay. All right. Okay. The other thing I'm going to look into, and I don't have any information at this point, I've had several questions about the funds for businesses through the SBA. You've probably been hearing a lot of that on the news. I don't think those are available for governmental entities, but I'm going to do some research on that later today. And we probably won't do a Zoom conference on that, but we'll put something out in the e-newsletter. If you're not subscribed to the e-newsletter, you need to be, and anybody can do that. And go to our website and make sure you're signed up for that, and you get all the latest information. Okay. All right. It says, question is, how effective is it to use Zoom with users when they have audio enabled? Audio is not a problem. The video can sometimes slow things down. What we found is when we had, and we've done several of these with staff, if you have video going and audio and everybody can talk at the same time, nobody can understand what anybody says, and you have to be careful about having everybody's mic on. So, but it works really well. There's a way that people can actually raise their hand and you can unmute their mic and they can ask the question, everybody can hear it, or make a comment, and then you mute them again. The host controls all of that. So with a little practice, I think you can do it really easily. And once everybody gets used to and familiar with it, it's really nice to do. And again, because it's video conferencing, you can do board meetings with this and have votes. And so it's really nice. And you can participate. Some of you have participated by phone. Some of you have participated on iPads or tablets. You can do computers. So, you know, any kind of a device. And even if you have just a regular phone, you can call in on the phone and listen. You just won't be able to see any, you know, to see the video or see anybody else. But it's really a good format. We're probably going to be doing more of these, I anticipate. So, and so let me know. I can do a private Zoom with you sometime if you want to practice. Just let me know what we can do. Question about, is there a concern with security issues on Zoom? There was, and you heard on the news where Zoom is getting hacked, and probably heard it by Zoom, because Zoom is, as my son who's a computer geek said, Zoom is the big boy in the room right now. Everybody's using Zoom practically, so they're the ones that are getting all the attention. But they've done, I know they did a bunch of updates this weekend on security. There's things you can do if you noticed, we had waiting room, and we didn't admit you into the meeting until we're fairly confident of who you were and that you belonged here. So there's things that you can do for security when you set up a meeting to make sure that the people that participate are supposed to be the ones participating. And again, the host can mute everybody. You can turn off everybody's camera. So I think they've had some press recently, but they're working on those security issues. And, you know, if you conduct a meeting with your board, it's supposed to be open to the public anyway. You just don't want somebody hijacking your screen and putting something up that's inappropriate. But the host can disable that also. So, okay. So question is, the employer pays all the leave with no reimbursement, and do you need a physical medical excuse, or can it just be a verbal recommendation? You know, if they've been recommended by a health professional to self-quarantine, I would think you would want that documentation in your file. And that may just be a note from the doctor with the doctor's name and who they work for, saying, yes, Joe Smith has been recommended to self-quarantine for COVID-19, okay? So you do need some documentation in the file as to which reason they qualify for, okay? If there is a quarantine or isolation order put out by the local government, you'd need a copy of that order, which you probably can get by calling whoever issued the order. But I don't believe that's been done in Missouri, so. But yes, you would need some type of documentation in the file just to say that, yes, I've ordered them to quarantine, or yes, this individual is quarantined and I'm their caretaker, right? So, but a verbal recommendation, I don't know that would work for the document, for keeping in the document file. But again, you know, I'm not an expert on this, but I would think if it's medical, you'd need medical. Okay. All right.
Liz, for those questions about Zoom security, when we do a video in a chat message for Zoom, we'll share those security settings with everybody.
Okay. So yeah, Jim said we'll share those security settings with everybody when we do a Zoom chat. So you'll know what those are. But at this point, I don't know that I would be super concerned about the security issues with Zoom. I think they're working on that, and we haven't had any trouble here. So, and I think that would be true with any format you used. It's just that Zoom, like I said, Zoom is the premier service right now, so they're the ones getting all the attention, and I think most of the schools are using Zoom, so there's a lot going on. I should have bought stock in Zoom about 2 months ago, but oh well. Okay. Any other questions? Okay. Well, if you think of any, feel free to send me an email or a text, and we'll answer those. And if that's all, then we're going to end the meeting, and we'll see you next time on Zoom. Thanks, everybody.